My name is Erica Carter, and I teach second grade at Southside Elementary in Versailles, Kentucky. My cancer journey is a very different story. I had just gone in for a normal checkup for yearly for my OB appointment, and she draws blood. And with that, my white counts were a little off. So I waited, of course, because I thought, well, it's just I'm sick or run down. And I went back a month later. They hadn't changed, but they were still low. So they sent me to another doctor. He thought everything was fine, but let's monitor again. Well, within a couple weeks, my counts had dropped dramatically. I get a call that I immediately need to come in. We go to the doctor, and they're like, you're not going home. You need to pack up, have somebody pack up for you. You need to go straight to the ER, and you won't be going back to teaching the rest of the year.
My name is Dr. Gerhard Hildebrand, and I am Erica Carter's physician. Erica was admitted to our unit with a diagnosis of acute leukemia, and we as a team basically took care of her from day one.
So it was a huge shock. I didn't feel bad. I didn't have any of the symptoms. I was very, very surprised. I was numb. I just kind of didn't have many feelings at that point. I just couldn't believe my world was completely rocked.
So leukemias are cancers of the white blood cells, basically, where white blood cells grow and expand and basically push healthy white cells aside. There's chronic forms, there's acute forms. And APL is acute promyelocytic leukemia, which is a subtype of acute myeloid leukemia.
APL was the leukemia that I had. And in the 70s, what's so crazy, it was the deadliest cancer. And it would hit you hard and fast. And so what I learned in that first month is apparently that could have gone really poorly, which I didn't know.
And it's characterized by certain genetic mutations and risks basically, which fortunately allow this disease to have a higher cure rate than other leukemias.
Since the 70s, it's the most curable. And the weirdest part is my chemo is arsenic.
I said it's highly curative, you can cure it in a large number of patients. But the criterion for this is that the patient gets to a center who knows to treat this disease immediately, as fast as possible. And unfortunately, our survival data, our numbers of surviving patients, often forgets about those who are somewhere outside in the countryside and do not get the treatment in time. There are very severe complications, specifically with this leukemia, very severe bleeding risks. So really, there are a lot of efforts now ongoing nationwide to make the community physicians more aware of APL, to bring them to the centers of excellence faster.
So I went to the rheumatologist, and then within that 2 to 3 weeks is when everything, you need a bone marrow biopsy, and then right after that, it was you're going straight to UK ER. And so that's where I got plugged in, and it was great support, great support. I love UK and Markey Cancer Center. It's been wonderful.
In her case, treatment basically extended roughly over 9 months. I think it started in September and ended in June. Yeah. So that if you think about this, how this affects someone's life is tremendous.
128 treatments later, I'm, cancer-free, and it was a very different year.
If you have a patient who does remarkably well and goes back to daily life and enjoys really doing what the patient did before, like Erica with her kids in this classroom, it's for me just really, I think the reward for the entire team, showing us that what we do really has a higher meaning to the patient, and I think it's just a unique moment.
I love the children. They make me laugh. They love on me, and that I could have a rough day, but I got to check that at the door, and I got to walk in and put that smile on my face for these kiddos. They're gonna look back. I remember my elementary days, and I don't want them looking back not enjoying school. I want it to be just a fun experience for them, and love learning and love education. It's just, one of those bumps in the road you don't choose, you don't want for anybody else. But as we all know, we're all, been affected by cancer.